Good afternoon, everybody. Wynn Brown here with Heywood Healthcare's COVID-19 update for Monday, December 14th. 2 weeks till Christmas Eve, so I hope you're all getting your shopping done and your houses are all decorated. Just to give you an update, we've got a lot to report today. Our cumulative testing rate has inched up to 2.9% throughout the pandemic, now matching the state at 2.9, and you'll find out why in a minute. Our 7-day average rate has, wait for it, increased to 8.02% versus the state rate of 5.61. We had 50 positive COVID test results, the majority outpatient, last night in our testing. So that is the highest we have ever seen it, and why our positive rate has gone up to 8.02 over the past week. So again, we'll talk a little bit more about the things we need to do. In Worcester County, total positives tested are 32,452, and the state today will pass 280,000 cumulative positive findings. That's a rate of 50 per 100,000. So just putting a call out to you, if you've been following these, right now we have 16 inpatient patients with COVID-19, 4 of which are in the ICU. And we've been managing that capacity very well, but it still is a big strain on our system. So please make sure you're social distancing, your hand hygiene, staying out of crowds. We know what we need to do, and I just encourage you to do it. You know, we have a major surge coming off of the Thanksgiving holiday, and we're moving right into Christmas holiday and New Year's and Hanukkah and what's going on now. So please pay attention to that. I know a lot of you are questioning what's going on with the COVID-19 vaccine. Obviously, it's forefront in the news. We are expecting our first shipment of the Pfizer drug to arrive at the end of this week, either Wednesday or Thursday. We have a snowstorm coming, and it's the federal government delivering, so we don't have the exact date, but it's probably Wednesday or Thursday with 975 doses. We're finishing our priority listing and getting ready to run that over the 5 days afterwards so that we can get that vaccine out to our direct care providers. So please look forward in your emails, everybody on staff, for the distribution procedures for that coming up, because we're going to need everybody who is opting to take the vaccine in the know on that. Also, we need volunteers to help clinically and administratively with the vaccine. And there's a note with a little registration button on the email that you can click on if you'd like to be a part of that. Also, a frequently asked questions is being developed for those of you who are trying to decide whether or not you want to take the vaccine, and so we'll have an FAQ up for everyone on the intranet. Just another reminder, do not delay care. We are seeing in both of our ERs people who have put off getting their care and arriving much sicker, much more compromised than they would if they had sought care earlier. So please reach out to your primary care physician, see them in person or via telemedicine. Go to one of our urgent cares or go to the ER if you have really acute urgent needs. Do not put off that care, because we're seeing it play out, and that's why we have a number of inpatients that we have as well, because they delayed their care. And also do remember that we have televisits available at all our practices, and that is available for you. So just to remind you about safe care at Heywood Healthcare, we have social distancing guidelines, stringent cleaning procedures, increased touch-free processes, hand sanitizer stations, universal masking, screenings upon arrival. We only allow no more than 1 or 2 staff in a break room at a time, and our dining rooms are socially distanced as well. So just to let you know that. Ending on a high note, Leapfrog released its fall grading today publicly, and Heywood Hospital received an A, Leapfrog Hospital Safety Grade, which is a national distinction recognizing our achievements in protecting patients from harm and providing safer health care as well as higher quality health care. So we are very excited about this. Congratulations to all our staff who helped make this possible as we continue our journey to be one of the best community-owned health systems in America. Thank you.